Hello, my name is Nicholas Medina, and today I'll be presenting the digestive system. So, some basic anatomy and physiology information about the digestive system. We have two main functions, digestion and absorption. Digestion includes the breakdown of large insoluble food molecules into small water-soluble food molecules, and there's two kinds of digestion, mechanical and chemical. An example of mechanical digestion would be our teeth breaking apart, biting down, chewing on the food that we put into our mouth to allow for us to swallow that food. And an example of chemical digestion would include our stomach juices mixing, interacting with the food located in our stomach. We also have absorption as a main function of the digestive system. And absorption, the definition is going to be the movement of nutrients, water, and electrolytes from the lumen of the small intestine into the cell, then into the blood. Absorption is vital for us to live. While our digestive system breaks down the food through digestion and then absorbs the nutrients from that food to allow for us to use the nutrients. And then some major organs of the digestive system include the mouth, esophagus, stomach, small intestine, pancreas, liver, and the large intestine. So continuing on the basic anatomy and physiology information of the digestive system, these are all the major organs of the digestive system. They all work together to digest and absorb the food and liquid that we intake. Because there's a lot of them, I'm not going to go through all of them, but for example, the stomach, it mixes food and liquid that we consume with the digestive juices or the stomach juices called chyme, and it also is a temporary storage place for food and liquid. The pancreas, it makes hormones and digestive juices that help in the digestion process. And last but not least, the large intestine, which absorbs water and salts from the material that has not yet been digested, and it's also the storage place of fecal matter. So appropriate terminology in regard to the digestive system. These include chest. The terminology will be thoracic, thorax, or thoraco. The liver, hepatic or hepato. An example of hepatic or hepato being used in a real word would be hepatocytes, which are the cells of the liver. We also have intestines, which are the cecum or colon, mouth, oral, os, stoma, or stomat. And an example of this would be stomatitis, which is inflammation of the mouth and lips. And we also have the stomach, gastric, and gastro. And continuing on with appropriate terminology, we kind of here have just some basic directional terminology. Anterior being paired up with posterior, superior paired up with inferior, medial paired up with lateral. And these mean anterior in front of, posterior behind of, superior on top of, inferior underneath of, medial in the middle of, lateral and on the side of. So we also have 9 regions of the abdomen. So starting off right in the middle, the umbilical region. This is home of the duodenum, small intestine, and the transverse colon. And then we also have the epigastric region, which is directly superior on top of the umbilical region. And the epigastric region houses the liver, stomach, spleen, duodenum, adrenal glands, and the pancreas. These are vital to know because looking at a patient's stomach, we can't really see the organs because of the skin, because of the fat in front of it. And so it's vital to know that for example, the sigmoid colon is in the left iliac region, or the right kidney being in the right hypochondriac region. As a health professional, it just makes your life a whole lot easier knowing these 9 regions and the organs that are located inside of each. So putting all of that information into practice, with this picture on the left, we can see the person is facing to the right of where you are seeing or where I am seeing as well. And so that means their stomach, the anterior portion of their body is facing right. And if we look at the gallbladder and kidney, we would say that the gallbladder is anterior to the kidney, as the gallbladder is closer to the front of the body than the kidney is. Vice versa, we could say that the kidney is posterior to the gallbladder, since the kidney is further back away from the front of the body than the gallbladder is. And the picture on the right, the stomach, that is on top of both the small and the large intestine. So in order to say on top of, we would say superior to. So the stomach is superior to both large and small intestines. While it is superior, as I just said, it's also inferior, but inferior to the liver. We can see the liver sitting right on top of it, that darker purplish brown organ right there. So some appropriate abbreviations. These include the GI tract, SI, LI, and GB. GI tract being short for gastrointestinal tract, SI being short for small intestine, LI being short for large intestine, and GB being short for gallbladder. And this is important because there are some pretty long words in the medical field, and using these abbreviations just kind of simplifies everyone's job and just makes everyone's life just a whole lot easier. Last but not least, how is this important to healthcare overall? It's the digestive system is, in my opinion, one of the most important systems in the body. In order to live, we have to extract the nutrients from the foods that we eat, and this is all done by the digestive system along with digestion. With digestion, we kind of break down the food a little bit more in order to get it to smaller pieces, and then the absorption process takes over from there. As I previously said, with absorption, we're kind of extracting the nutrients like vitamins, minerals, proteins, carbs, fats, all of those. The absorption process extracts all of those and allows our body to use them in order to continue living.